Schistosomiasis. Schistosomiasis is known as a snail fever. Is a disease carried by freshwater snails infected with one of the five varieties of the parasite Schistosoma. Schistosomiasis is transmitted by contact with contaminated fresh water, such as lakes, ponds, rivers, dams, inhabited by snails carrying the parasite. Swimming, bathing, fishing, and even domestic chores such as laundry and herding livestock can put people at risk of contracting the disease. Larvae emerge from the snails and swim in the water until they come into contact with an individual and penetrate the skin. Once inside the body, the larvae develop into male and female worms, which pair up and live together in the blood vessels for years. Female worms release thousands of eggs which are passed out of the body in the urine and feces. If people urinate and defecate in bodies of fresh water, the eggs migrate to snails where they eventually hatch and begin the cycle again. Symptoms for the disease vary depending on the type of worm involved and location of the parasite inside the body. This can include initial itching and rash at infection site, frequent painful or bloody urine, abdominal pain and bloody diarrhea, fever, chills, and muscle aches, inflammation and scarring of the bladder, enlargements of the liver or spleen and lymph node. If infection persists, bladder cancer may eventually develop in some cases. Children with repeated infection can develop anemia, malnutrition, and learning disabilities. Schistosomiasis affects about 240 million people worldwide and is estimated responsible for over 200,000 deaths each year in Africa alone. Treatment is available to eliminate the flatworm but cannot undo the damage from the eggs.